No, it still occurs,
All right,
unfortunately.
time's now 9:13, and the CDC has issued its strongest guidance to date as far as the vaccine is concerned, urging pregnant women to get vaccinated against COVID-19. This morning, we're joined by gynecologist Dr. Ericka Stone with more on what pregnant women or women who want to become pregnant need to know about the vaccine. Doctor, good morning to you. We appreciate your time.
Thank you so much for having me.
So we had a brief conversation prior to us coming on air, and the one thing I think we need to kind of drive home to everyone is the latest guidance from the CDC as far as vaccines and pregnant women are concerned. Where do we stand as far as that's concerned?
The CDC came out recently urging women who are pregnant, thinking about becoming pregnant, or those who deliver to receive the COVID vaccine as soon as possible. Not only the CDC, American College of Obstetricians and Gynecologists, Society of Maternal-Fetal Medicine, all of the organizations that we use to help us guide on how to treat women, particularly in this state of life, have urged us to encourage our patients to receive the vaccine.
And Dr. Stone, I know there has been so much misinformation on social media, across the internet, etc., about the risks that pregnant women or women who want to become pregnant face by getting the vaccine. As far as what you've seen in your office, would you venture to say that you run way more risks not being vaccinated and coming down with COVID than you would ever from the vaccine itself?
Definitely. I have not had a patient had a reaction from the COVID vaccine, which is one of the few things that people will worry about, and that's from just getting the vaccine. But generally, pregnant women are not having any types of bad reactions. I've not had patients having miscarriages or early labors, anything that of receiving the vaccine, but I have seen many complications for patients who got COVID in pregnancy who have not received the vaccine.
And Dr. Stone, tell us a little bit about what you've seen. Again, you are a gynecologist, you're an OBGYN, so you're dealing with pregnant women every single day. What have you seen as far as your patients are concerned? I know you can't get into too many specifics, but with your patients and COVID, especially when they're pregnant, what have you been seeing?
Mostly the patients that are coming in with COVID in pregnancy are generally sicker than the average patient. Especially the Delta variant has had a tremendous impact on pregnant women. The first round for COVID, people got a little sick and things of that nature, but this round is we're having a lot more patients hospitalized, a lot more patients placed in the ICU, intubated. We've had a few maternal deaths, which is the hardest one for us, especially young, healthy women. We've had, one particularly I remember that she never got to see her child before she passed away from this virus, and she was unvaccinated because she received misinformation from family members and things of that nature. And that's disheartening from us, knowing that a lot of those things could have been prevented if she had received the vaccine.
Wow. I'm speechless after that, Dr. Stone. But again, I know there are a lot of questions and concerns around the vaccine, especially if women are already pregnant. And we have about a minute left, but is there any timeline when you shouldn't get the vaccine if you are pregnant, as it pertains to your due date, or should you just get the vaccine?
No. Everyone who's pregnant, thinking about becoming pregnant, or it has delivered a breastfeeding, we encourage them all to get the vaccine. If you talk to your physician, your pediatrician, your OBGYN, ask them the questions, talk about what are you concerned about, and they will be very happy to discuss those things, to help talk about the things that's on Facebook and things like that, and why those do not occur and are not accurate. That is the main thing. Our job here is to educate you, to make the decisions for you and your family. We hope that you can come to us with those questions.
Dr. Stone, again, I appreciate your time this morning. I know you are incredibly busy, so we appreciate your time and insight on this incredibly serious matter that, as you mentioned, can be preventable. We appreciate you as always.
No problem. Thank you so much for having me.